Kits for many still remain scarce. Drive-through testing sites are opening to deal with demand. Millions around the world heeding orders to stay inside. We're seeing what that looks like from above with satellite images of the Statue of Liberty. And take a look at this holy shrine in Iran before and after the coronavirus. And in Lisbon, Portugal, normally a bustling square, now devoid of human beings. But there is some good news and plenty of glimmers of hope. More than 83,000 people have already recovered, but there's still a long way to go. Our Whit Johnson leads us off with all the latest.
We are all in this together, and we'll come through together. It's the invisible enemy.
President Trump closing the northern border with Canada to all non-essential traffic and potentially limiting the flow on the border with Mexico. The Pentagon announcing those 2 hospital ships will soon be on the move. The Mercy deploying to the West Coast. The Comfort will head for New York Harbor. And today, a new warning for young people.
There are concerning reports coming out of France and Italy about some young people getting seriously ill and very seriously ill in the ICUs.
Doctors raising the alarm that too many millennials are defying orders to avoid crowds after countless images like these, young people descending on Florida beaches.
You have the potential then to spread it to someone who does have a condition that none of us knew about and cause them to have a disastrous outcome.
The president today asked why some professional athletes seem to be getting access to the test more easily than other Americans.
How are non-symptomatic professional athletes getting tests while others are waiting in line and can't get them? Do the well-connected go to the front of the line?
Well, you'd have to ask them that question. I mean, I've read. No, I wouldn't say so, but perhaps that's been the story of life. That does happen on occasion.
The federal government now working to make more tests available, expediting so-called self-swab testing kits to protect healthcare workers. The kits could be sent home, where a patient would do a simple nose swab themselves. A tech would then pick up the sealed sample, considered less intrusive than the current test, a process the president himself has experienced.
I can tell you because I did it. But we have a current process that's a little bit difficult.
Across the country, people waiting for hours to be tested and then days for results.
I'm just getting worse and worse.
Fahima Jamali has been homesick for nearly 2 weeks with her husband and daughter, desperate for a test.
I am because last night my braces stopped and I just used this.
She finally found a hospital to test her, but now the wait for results.
Feeling is really not good. I just need my results back and see what they want to do for me.
In New York State, the number of cases soaring above 2,400, at least 16 deaths. The governor pushing back against a possible shelter in place, instead issuing an executive order requiring all non-essential businesses to leave 50% of their workers at home.
I understand the anxiety, I understand the fear, but you also have to remember the facts of the situation, right? And the facts are still very clear. We know what this virus does.
In New York, more than 1,000 new cases in just the last 24 hours. But Governor Cuomo also pointing out that more than 100 New Yorkers have already been released from the hospital. And tonight we're learning that lawyer at the center of the outbreak in Westchester County, who is in critical condition, now seems to be on the road to full recovery. His wife adding on Facebook that he's awake and alert. His first words to her, "I love you so much."
And Whit Johnson joins us now from New York City. And Whit, earlier we heard President Trump talk about the Defense Production Act, but now he's clarified that statement?
Yeah, Lindsay, President Trump says that he has already signed it, but will only invoke this Korean War-era law in a worst-case scenario, adding that he's hopeful there will be no need. Lindsay?
All right, Whit Johnson, thanks so much for that. And we turn now to the threat to those we need most right now, our medical care providers. We're getting new reports of doctors and nurses contracting COVID-19 as they race to help others. Many say that they're still not getting the protective equipment that they need as more hospitals run low on supplies. And an update from one of our own at ABC News, a reporter tonight now recovering from her own battle with COVID-19. Our Matt Gutman has more.
Tonight, emergency room doctors and nurses warning that critical protective gear is running low and putting them in danger.
I think the big thing that we need on the front lines right now is personal protective gear for my colleagues and myself. I've got my mask for today right here. and I'm guarding it with my life because it could be my life.
Stephen Anderson is an ER doctor in Auburn, Washington. He says in about 48 hours, his hospital will run out of protective gear and masks. Other hospitals instituting severe rationing.
Now I'm getting a mask, and I'm told to hold on to that mask for the entirety of the week.
And across the country, doctors and nurses are getting sick. Emory University confirming they have workers who tested positive. San Francisco doctor Rosny Daniel isolating himself after being infected. He attended a conference with hundreds of ER physicians near Times Square. Healthcare workers with underlying conditions feeling especially vulnerable.
I have asthma when I tend to get even a common cold or the flu. I'm sometimes compromised.
The U.S. has a stockpile of 13 million N95 respirator masks, but the federal government has said up to 1 billion might be needed over the next 6 months. At Putney Health System in Georgia, they ran through 6 months of protective gear in 7 days. So volunteers are now sewing covers for masks using surgical sheets.
We've got an army of seamstresses making these for us in the community, volunteers, people from out of town.
But some critical supplies present a bigger challenge. Ventilators are already in short supply. Nationwide, there are roughly 170,000, but some estimates expect a demand of nearly 1 million.
We need ventilators. I have ventilators this morning, but the hospital up the street from me is out of ventilators at the moment.
Kyle Abernathy is recovering from an infection and is now watching his wife fight for her life and needing a ventilator.
She was at one point requiring 100% oxygen through the ventilator. Now she's down to 50%.
While many are struggling to overcome the virus, others have been able to recover in a matter of days. ABC's Kaylee Hartung contracted COVID-19 while reporting from hard-hit Washington state. When she got home, she started feeling symptoms, including a low-grade fever.
I had a headache just right between the eyes. I was congested. I had body aches in places that I wasn't used to having them. I am feeling so much better. This virus was something that really knocked me off my feet for a day.
And she looks like she's just about back to 100%. We're joined now by Matt Gutman. You've been reporting all week about medical supply shortages, but should we also be concerned that many doctors and nurses won't be able to come to work as more people self-quarantine?
And we're actually starting to see that, Lindsay, already. MD Staffing, one of the biggest doctors, nurses, staffing companies in the country, reporting a 20 to 30% spike in demands for temporary doctors and nurses. And also, doctors are just like us, as are nurses, right? They have kids who are not in school. They've got to be taken care of. They're going to be put in quarantine as well, and they are going to get sick as well. So this is a huge concern in the medical community. What happens when all of these doctors start to get taken offline? In addition to that, a whole generation of doctors is over 60 plus, right? And these are some of the most vulnerable groups. The irony is those are the groups that don't have to deal with child care, but they're going to be offline. So this is a huge concern for the healthcare system, Lindsay.
And of course, are there plans in place to make sure that hospitals have the personnel and supplies that they need as the coronavirus continues to spread?
There are plans in place, but nobody knows if they're actually going to be able to be effectuated, right? Because think about where we were a week ago. No one would have any idea that we would be where we are today. So there are plans. There's something called the National Strategic Stockpile, which has a tremendous amount of medical stockpiles, N95 masks, gowns, but we're told it's not nearly enough. And so what we're starting to see, Lindsay, are hospitals MacGyvering masks and any tools that they need. That group in Georgia stitching together those masks, they hope to make 200,000 of them relatively quickly. Maybe that will help with the shortfall, but basically a lot of these hospitals feel like they're on their own right now.
And MacGyvering masks, that doesn't necessarily mean that those are protective and safe masks, I'd imagine, too.
No, they think they're protected. I mean, you heard Dr. Darian Sutton talking about being told to use the same mask for a week. That's not quite sanitary, but they don't have a choice right now. So doctors are making do with what they can.
All right, desperate times. Thank you so much, Matt Gutman. And we'll speak with our Kaylee Hartung live, who is in your story later on in our show. The Senate today has passed a measure to provide sick leave and free testing amid the coronavirus outbreak. This as the administration continues to work on other measures to try to boost the economy. The biggest plan is President Trump's proposal to inject potentially more than $1 trillion into the economy. Half of that dispersed in 2 rounds of checks, potentially worth $1,000 to Americans under a certain income level. The plan also calls for a loan program for small businesses worth up to $300 billion and more money for the airline industry and other distressed sectors like hotels and hospitalities. ABC senior White House correspondent Cecilia Vega has those details.
Facing a growing pandemic and an economic crisis, President Trump today labeled himself a wartime commander-in-chief.
I view it as in a sense, a wartime president.
The president is pushing Congress to approve a massive $1 trillion economic recovery package, including $500 billion in direct payments to Americans, 2 rounds of checks sent out on April 6th and May 18th. $300 billion for small businesses and a $50 billion bailout for the hard-hit airline industry. His Treasury Secretary Steve Mnuchin warning lawmakers about what could happen without government intervention.
He said that unemployment could skyrocket to 20%. Are we looking that could rival the Great Depression? Are we looking at potentially historic
No, well, I don't agree
devastation?
with that. Yeah, no, I don't agree. That's a absolute total worst case scenario. But no, we don't look at that at all.
More and more, the president is now pointing the finger at China, repeatedly calling the disease the Chinese virus.
There are reports of dozens of incidents of bias against Chinese Americans in this country. Your own aide, Secretary Azar, says he does not use this term. He says ethnicity does not cause the virus. Why do you keep using this? A lot of people say it's racist.
It's not racist at all. No, not at all. It comes from China. That's why.
He's also on the defensive against claims that he wasted crucial time by downplaying the threat for months.
One day it's like a miracle, it will disappear.
Today, President Trump falsely claimed the virus, quote, snuck up on us.
Cecilia Vega joins us now. Cecilia, we heard the president continue to blame China when you pressed him during today's briefing. What was the response in the room to that?
Yeah, it led to a bit of an awkward moment in there today, Lindsay, because after I pressed the president on this, calling it the Chinese virus, I asked the people standing behind him, are you okay with him using this language? Do you agree with this language? And I've got to say, they all stood there with blank expressions on their face, and I pushed them again as they were walking out the room, and they could very clearly hear me, and they would not answer. Here, it bears repeating. This is why, Lindsay, this is so important. This is not just offensive language to many. This is not just what many are deeming racist language. This is potentially dangerous language. We have been talking with watch groups today who tell us that they are seeing incidents of bias against Asian Americans in this country on the rise, and they directly attribute it to language like this, linking this virus to the Wuhan virus, the Chinese virus. The president today said that he did not think it was racist to even call it the Kung flu. That's a term that came up reportedly in a conversation with my colleague at CBS and an anonymous White House official here. But, you know, those own health officials who were standing behind the president have publicly said in the past, no one should be using this language because ethnicity is not what causes it. But, Lindsay, I'm willing to bet the president is not going to stop.
And we just did a piece last week talking about that very issue as far as Chinese people feeling that they needed to buy guns to protect themselves. But another notable moment in that briefing, when asked about concerns that athletes and other well-connected people are getting priority access to testing, the president responded by saying, quote, "That's the story of life."
Yeah, that's exactly what he said. And you know this because this comes after stories like the entire Brooklyn Nets team getting tested. 4 players on the team tested positive, but the entire team got the test. The entire Utah Jazz team in the NBA also was tested for coronavirus. And meantime, we're hearing from doctors and patients, frankly, all over this country who say they need the test. They can't get the test. The president said he didn't know if it was factually the case that the rich and famous are getting to cut to the front of the line. But you heard him. He said that is the story of life.
All right. Cecilia Vega from the White House. Thank you, Cecilia. Despite those stimulus proposals, it was another brutal day on Wall Street. The Dow plummeting more than 1,300 points and has now erased all the gains that it made since President Trump took office. Trading was also briefly halted. That's the 4th time that's happened in the past couple of weeks. And breaking just a little while ago, the New York Stock Exchange will close the trading floor starting Monday. All trading will be done electronically. ABC's Rebecca Jarvis is downtown and joins us now with more. Rebecca, how's that going to work?
So, Lindsay, a lot of the trading firms that trade on the floor of the New York Stock Exchange have the capabilities of doing all of their business electronically. They choose to do their business on the New York Stock Exchange in normal times because it's a person-to-person contact business, but it's not necessary that they do that. And, Lindsay, a number of these companies, given that they experienced September 11th right in their backyard when the New York Stock Exchange did close the trading floor for a handful of days back then, created contingency plans so they could essentially conduct business as usual, make the trades for their customers as usual without having to physically be on the floor itself. Anybody out there who's watching right now, if you have a 401k or an E-Trade account, any type of activity that you would normally conduct in the stock market, you still can conduct in the stock market under these new changes, Lindsay.
And let's move beyond Wall Street to the real-world impact of all this. Some reports say that the Trump administration was warned unemployment could reach 20%. We've seen huge drops in business for the airlines, hotels, and today Ford and GM announcing that they would close factories in North America. How bad could things really get on the job front?
Well, this is the big concern, Lindsay, because with the number of companies that have been forced to close, the number of small businesses that have been forced to close, the number of unemployment claims has been skyrocketing, and we've seen it in states across the country. In Michigan, those unemployment claims jumped overnight 550%. It's a big deal, and the biggest concern is those employees getting cash in their pocket in the course of time while we're in this shutdown span of time so that people can make their mortgage payments. They can afford to buy groceries for their families while we weather through this. I will say that today, the president did make an announcement that there will be no foreclosures or evictions, that HUD will enforce that through the end of April. So people who are running behind on those payments, if they don't have the money because of the fact that they've lost a job or are weathering it through this storm, will be protected. Also, a number of banks, and this is something I would really highly recommend if you are worried about making payments on your credit card, on your mortgage, contact your bank, contact your credit card company, because, Lindsay, a number of banks and credit card companies have put out guidance that they will not be charging interest or late fees if people miss a payment this month. I would also say, though, if you can afford to make those payments, you should. You want to make sure, because it will grow over time, and in good times and in bad, that's the fact. So if you can afford it, make it, but also contact your bank if you can't, because they will work with you. A number of them will at this time.
Some sound and helpful advice, as always. Thank you, Rebecca. Joining us now is West Virginia Senator Joe Manchin. Thank you so much for joining us, Senator.
Thanks for having me, Lindsay. Appreciate it.
Wanted to start right out. Yesterday, President Trump was praising West Virginia, saying that the governor had done a good job because at that time you all did not have anyone who had tested positive for coronavirus in your state. What was your reaction when you heard that?
I just couldn't believe it, because they should know the facts. We had very few people even tested, period. That's the reason. Up until that time, we only had 84 tests done out of 1,800,000 people. I've got people slamming my office as we speak right now, Lindsay, basically saying, we need to be tested. We have symptoms. We can't get tests, but I will say this. Talked to Mike Pence last night. Vice President Pence is working, trying to get us the testing equipment and all the supplies. West Virginia should be a tier 1. We have the most vulnerable people. We have an elderly population, a sickly population because of all the hard work they've done with respiratory diseases. And we've got to make sure we're on the front end of this. If not, it'll be carnage. It'll be just a tsunami that'll hit us, and we're not prepared for it.
You still feel that you're not prepared at this point?
We're getting there. We're going to be getting there. We've done all the things. I praise the governor and people who did the right thing by basically shutting schools down, stopping social gatherings, all the things that we should be done that Dr. Anthony Fauci said that we should do, limiting our social access to people, and we're doing everything they've said. But from that, when you have a very fragile population, it's going to spread like wildfire if you're not on top of it. We don't know where we might have it. We don't know where maybe in parts of the state we could basically isolate that a little bit more. The better we're able to control this horrific virus, and that's same for the whole country right now. But we just don't know.
When we talk about the whole country, the Senate has just passed phase 2 of the coronavirus stimulus measures. It calls for 2 weeks of paid sick leave and up to 12 weeks of paid family leave for many Americans, free testing, additional funding for unemployment insurance, and the expansion of food security programs like SNAP. Senator, is this enough?
Well, it's not enough, and we know it's not enough. That was the second tranche we said. With that being said, it basically does get free testing. It's going right to the medical end of it where we need to go. Lindsay, we need to find, first of all, the money we have on the first that we spend right now is for two purposes. First of all, to find any type of treatment that we think that if you contract this virus, how can we give you relief? How can we help you get better? Next of all, finding a workable vaccine. That's going to take a little bit longer. So when you're doing that, basically treating people that are affected and trying to find a vaccine, that's your first and foremost. Next of all, how about the people that had to go home and said, hey, we're going to close your businesses so you have no place to work? Those are the people on the front line. Sending me $1,000 is not going to help the economy. Sending you and all of us who have paychecks right now, sending the people that are getting social services is not going to help because it's not changing except their social interaction. What we need to do is be focusing on the people that have really been affected. That's the people on the small businesses, front lines, that are sent home with no hope whatsoever, and no unemployment compensation. We need to expand that, work off the existing programs, and we can keep this moving. Having long-term, basically, relief for businesses, small businesses, that can survive, that doesn't have the capital like large corporations. And making sure, Lindsay, large corporations, if they need loans, low-interest loans, basically, from the United States government, we can do that. I'm just not in favor of bailing out for the sake of bailing out people that got the greatest tax breaks in the world.
What message do you have, people, for living in states with low confirmed cases such as yours? Do you think that people in those states potentially have a false sense of the risk?
Sure, they get a false sense. When you see the President of the United States or the governor of the state of West Virginia saying, hey, if you want to go to Bob Evans, go ahead and eat, that's wrong. No, you should not. And if you see the president say, must be doing something right, we don't see anything in West Virginia, so we'll make you a Tier 2. Tier 2 means we're not on the high priority list. I called last night and said, let me tell you one thing. When it hits my state, it'll be more than Tier 1, I can assure you. And I want to prevent that from happening. These people work too hard. They're too darn good to be left and felt like, well, we'll wait to see whatever happens. If something happens, we'll be there. That's too late. So hopefully we'll be moved up to Tier 1. That means we're going to have the supplies we need. We'll have the testing and also the rapid response. Right now it's taking 5 to 7 days if you do get tested in West Virginia before you know. One guy came to me and said, Joe, if I'm as sick as I am 7 days from now, I might be dead. So they're concerned. So we're doing everything we can to bring the alertness to the federal government that we need you in West Virginia, making sure the most vulnerable people in America aren't left behind. And it's not too late for them.
And you mentioned the elderly population there. 20% of your state is over the age of 65 years old. How will you handle this particular high-risk group?
Well, that's the thing. I've said this. One thing about our state is that we do try to look out for each other, and we take care of our neighbors. If you have an elderly person living with you, a relative, or if you have an elderly neighbor, try to do some shopping for them. Try to help them so they have the necessities that they need to sustain themselves. Don't have them going out in stores and going out in public if they don't need to right now. If we can all be a little bit disciplined for the next 2 to 3 weeks to see where this curve's going to go, if we can get a handle on it. Right now it continues to grow. More people are getting this disease in America, and we're going to see more deaths from it. And we want to prevent that. And you can only do it by being disciplined. But you got to help your neighbors, help your families that are elderly. Anyone that has illnesses, help them. That's the most important thing we can do.
City dwellers are getting a lot of attention and resources, but there are also special risks to rural populations, of course, where hospitals might be more spread out, for example. Is your state getting the resources that it needs? You said that you had talked to the vice president, for example, last night. Do you even have enough tests? Will you have enough tests? We don't have enough. We only had 500 tests for the whole entire state of West Virginia. Can you believe that? 500 is all we had. As I'm speaking to you now, they're supposed to be getting more to us immediately. We have very few respirators or ventilators that would help people, and we have a lot of respiratory problems because people worked in heavy industry. So we know we have all of that hitting us on top of a pandemic.
Good evening, Los Angeles. Thank you again for joining me for my daily briefing on letting you know what's happening with our heroic fight to slow and to win the war against coronavirus here in Los Angeles. I know these times have been tough, and I want to start tonight by again just speaking to you about how difficult these days have been. I know that it's easy to feel scared or lost, to feel unmoored from the usual things that are the foundation of our life. But even as we feel unmoored, there have been amazing anchors of generosity that we've seen all around this city. We've seen the woman who posted on Nextdoor asking if she could pick up groceries for senior citizens who live in her neighborhood. The synagogues that are calling people just to let them know you're not alone. Folks across the city that have given to our emergency COVID-19 crisis fund. These are acts of generosity, acts of kindness. I'm so proud to be an Angelino and to be your mayor. I'm also so proud to work hand in hand with mayors across this county and our County Board of Supervisors. But I want to talk to you personally tonight a little bit about your health. And I want to make sure that you're taking care of yourself as we all hunker down in Los Angeles. These can be very tough days, and you might be asking what you can do to relieve the stress that you're feeling. Here's my advice. Check in with loved ones. See how mom's doing. Call a friend you haven't talked to in months or even years. Reestablish real human contact. Don't just stay on the internet reading the stories about the crisis, but make sure you have time to hear, to smile, to laugh, to interact and to listen with people who are, for all of us, the foundation of our stability. Make a plan, and if you're depressed or feeling down, determine what can you do tonight to feel strong again. And if you need help, it's out there. Don't be afraid to ask for it. Thanks to our Los Angeles County Department of Mental Health, there's a hotline that you can call at 800-854-7771. Or if you prefer to text with somebody real, use the crisis text line and initiate a conversation with trained counselors by texting HOME at 741-741. But bottom line, reach out to each other, interact with each other. Life will continue, and we will get through this. Next, let me catch you up on the latest news since yesterday. By now, I can see that we all understand how important social distancing is in this fight. It is our largest and most important weapon. That's something that pushes the day off that our healthcare system will be overwhelmed by the number of cases that we have, a day that all of us hope will not come. But in the face of that problem, our most promising solution is you. The power is in your hands. The choices that you make, the distance that you keep, these will be the factors that determine how this chapter of our city's history is written. And nothing is more important right now. As you heard today from the Department of Public Health for Los Angeles County, there are now 190 confirmed and diagnosed cases of COVID-19 in LA County. Remember, these are only the numbers of positive tests that have come back. Too few people are being tested, and there's a delay in those tests of 4 to 6 days. So this is really a snapshot of a few days ago and a reflection of the testing capacity as it grows. I want to remind everybody that all of us are safer at home. Let me repeat that. All of us are safer at home. That is the direction of the Department of Public Health. That is what the science tells us. And that is what we've seen across the country and across the world. We know that this is the right way to respond to the pandemic. Listen to our county health professionals. They have been clear. If you can stay home, stay home. If you can work at home, work at home. Only our critical workers should be going to work, and they should practice social distancing whenever humanly possible. And I can see that Angelinos are answering this call. What seemed impossible on Sunday when we took some of the boldest measures in the country have resulted in quite empty streets, shopping malls that look like ghost towns, schools that are closed, and buildings that are a small reflection of what they once were. I know that can seem unsettling, but those pictures are good news and proof of the progress you are making. I know that critical workers and members of the public still need to get to work in some cases, and of course, get to the grocery store or pharmacy. And many Angelinos depend on public transportation in LA County. So let me give you an update there. Our residents have to ride those buses and trains to get them where they need to be. So I want to reassure people that LA Metro will keep running those buses and those trains. They'll be talking to all of us a little bit more on Friday about the way they're adjusting schedules, but I want to reassure people that it will never close. In fact, we need to make sure that our nurses, medical assistants, folks who are cleaning our hospitals, our grocery clerks, and others who don't have their own car and have no other options can continue to get to work. Metro crews have been cleaning religiously, adding all of the extra cleanings to make sure that those spaces are safe, and we ask riders to make sure that they also maintain as safe a social distance as possible. The agency will, as I mentioned, release more detailed information about those ridership numbers, about any operational changes, but I want to reassure people that you can still go Metro to do the critical work that you need to do if you're a critical worker, and to do those errands that we all will need to do throughout this crisis. As with Metro, we continue to coordinate across Los Angeles County with our partners. And I want to thank County Supervisor Catherine Barger and Long Beach Mayor Robert Garcia, who led a call today with the 88 mayors of Los Angeles County, a planning meeting, and we heard from mayors from Avalon to Whittier, from Calabasas to San Gabriel, and beyond. It was a call to discuss how we can all plan to be safer at home and to prepare for steps that we probably all feel are inevitable in the days ahead. As we coordinate together, copy best practices, and ensure that there are no loose ends of one city's gymnasiums open while other ones are closed, and that all of us are reinforcing that it is safer at home and that we all have that work to do. How can we travel less, see fewer people? How can we telecommute and still do our jobs? I'll reiterate what I said last night, though, because I know it's on a lot of your minds. Shelter in place and lockdown are not phrases that we should be using. Shelter in place, they're the wrong descriptions to describe not only what we see here, but even in those places that sometimes are described with those terms in San Francisco or San Jose. Shelter in place refers to stopping where you are, usually almost always not at home, during a public safety emergency like a school shooting. And lockdown implies that people literally cannot leave their home or wherever they are. Today, the unprecedented measures and closures in our city and across our country and county, continue. But every day, every hour, we are monitoring this situation and evaluating new orders. And let me assure everybody, I will be prepared to take whatever steps are recommended by our county in coordination with all of the cities across this county. We are all safer at home, and we hope that you will continue to do just that. This isn't LA's first emergency, so let me turn next to the great action that we saw from our city council, and I want to thank council leadership and council members who spent an entire day making sure we were ready to meet this challenge. I want to reassure those residents of LA City, our reserve fund is at twice the level it was, a record level, and twice what it was before the 2008 Great Recession. And because we did plan ahead and we socked those dollars away, we were able to work together with the City Council to secure $20 million out of the reserve fund. I want to thank our chair of our Budget Committee, Paul Krikorian, and council leadership for creating the COVID-19 Emergency Response Fund, to put the full might of our government behind the response, to buy the things we need, to offer the relief that we can while we wait for even more federal and state assistance. With the new emergency fund set up, we will have the tools we need to ramp up clear and coordinated actions in the face of the pandemic. And in the spirit of mobilizing every resource at our disposal today, I activated the Disaster Service Worker Program, something under the powers that I'm accorded in the Charter. This is a step that allows us to redeploy any city employee necessary to combat this crisis, including our efforts to house the homeless. As we ask people to remain safe at home, we know that too many Angelenos don't even have that option. They have no home to go to. If we do not act now, this pandemic could see our homeless population disproportionately affected, and they already disproportionately have the underlying health conditions that make them the most susceptible to morbidity. In simple terms, they are the ones who disproportionately could die as a result of this crisis. Many Angelenos know long before this pandemic reached our communities. We've rolled out in the county of Los Angeles, thanks to the voters, and across our cities, many comprehensive strategies to combat homelessness. I think stood in this room less than a year ago saying we needed a FEMA-level response. And while we've seen some more dollars come, thanks to Sacramento and Governor Newsom and our legislature, and negotiations commence with our federal government, we may finally be getting some of those dollars that we need in this crisis to bring our homeless home and to address this public health emergency. We have launched before the crisis the swiftest deployment of shelters anywhere in America, alongside adding new supportive permanent housing units, expanding our existing stock of affordable housing, and providing vital sanitation and health services to folks both living on the street and people living near them. Over the past 19 months, we opened 12 new bridge home shelters, transitional housing shelters with 813 beds, and another 14 are due to open stations and 120 mobile bathrooms at encampments, because good hygiene practices remain an important tool in this fight. And while we have 0 confirmed COVID-19 cases among the unhoused in Los Angeles, we know there are probably cases out there, and this could change any moment. So I've directed our city to launch an unprecedented effort to move folks to safety. As we make thoughtful and strategic plans in the days ahead, we're working to identify those who are the most vulnerable out there, instructing our Homeless Services Authority throughout the county to identify the 4,000 individuals who are most at risk